For students who are curious about sexual health and its relation to the coronavirus, there are a few things that we should cover. Modes of transmission, COVID incubation periods, and susceptibility. As of right now, there is no current evidence to suggest that COVID-19 is spread via sexual transmission, or vaginal and seminal fluids. However, there are certain sexual acts that may put one at more risk. These include kissing, oral sex, analingus or rimming, and this is because COVID-19 can be passed from person to person via saliva and fecal matter, making these sexual acts more risky for COVID-19 transmission. Because there are many sexual acts involving close skin-to-skin contact, engaging can put individuals at a heightened transmission risk overall. COVID can exist asymptomatic between 2 to 14 days depending on the individual. During this period, the virus can still be transmitted between individuals, so sharing wellness histories with your partner can be useful to reducing COVID-19 risk. Finally, susceptibility. Some individuals may be more susceptible to a severe case of COVID-19 than others. These include individuals with certain pre-existing conditions and compromised immune systems. Also, the prevalence of certain STIs can make one's immune system weaker and potentially cause a more severe COVID-19 infection.
For those who are interested in having sex, there are a couple different strategies just to keep in mind to keep yourself safe. One is just being aware of how the virus spreads. We know it does spread through just direct contact with either saliva or mucus. It's important to be mindful of just basic protection that you'd be using during a typical time as well. So folks should be continuing to use dental dams, condoms, latex gloves whenever possible, and absolutely washing face and hands before and after sex. And this extends to devices, sex toys, keyboards, phones, computers, whatever is being used, making sure to wash before and after. The safest ways to have sex are either with yourself or with a partner that's in your home. We know that may not be possible for everyone at this time. So a couple different strategies to keep in mind for folks that are choosing to leave their homes to have sex while also practicing physical distancing. First and foremost, if you're not feeling well, don't go on a date. Communication around that will be particularly important to just ask any potential partners if they may have been exposed and then sharing with them if you've been exposed as well. Something else to be mindful of is just talking with your partner or your partners about what you feel comfortable doing during this time and using kind of the safe sex practices. Another thing to be mindful of is maybe having one regular partner, consider pausing group or casual partners at this time and figuring out who you feel comfortable in having sex with. For queer and trans students who are interested in continuing to engage virtually while also maintaining physical distancing, you might have to get a little bit creative during this time. This could mean connecting with potential partners or ongoing partners over apps, video, chat, text, sex, whatever feels comfortable at this time. This could provide an opportunity for some new things that you try out and some additional maybe conversation as well. A couple different apps that we are including are geared towards LGBTQ folks in general. One is focused more for queer women, trans women, non-binary, and genderqueer folks. That's called Lex. Another one, Grindr, which again is encouraging folks, particularly queer men, to connect socially while following the CDC recommendations on physical isolation. And Jacked as well, which is an app geared towards queer men of color. So check those out if those are not something you have seen before, and stay safe.